Hello, everyone, and thank you for joining us on Have You Heard, Armor Animal Health's online video series. My name is Joe Grotsun. I'm a sales rep with Armor Animal Health here in Mandan, North Dakota. Currently, I've been with Armor 4+ years now, and I live just a little bit north of Bismarck in Baldwin, North Dakota. We'd like to know where you're watching from today, so please leave a comment in the comment section and let us know where you're watching from today. We also want to let you know to keep this interactive. If there's questions along the way that arise as the presenters are speaking today, please leave those in the comments section as well, and we'll get to those at the end of the presentation. Joining me today is Dr. Jacob Carlson, one of Armor Animal Health's professional service vets, as well as Dr. Cortese from Zoetis. Dr. Jacobs primarily focuses on beef cattle with Armor Animal Health in North Dakota and kind of the surrounding states. He's been with Armor Animal Health for 2+ years, and this is actually his third appearance on our video series. He lives north of Bismarck as well with his wife and 2 children. Dr. Jacob, thanks for joining us today.
Thank you, Joe. Thank you. So I'm going to introduce Dr. Victor Cortese here. Vic graduated from Michigan State University with his bachelor's and his doctorate. He received his doctorate in veterinary medicine in 1980. He then entered a mixed animal dairy practice in Wisconsin, where he also held a non-tenured adjunct professor position with the University of Wisconsin-Madison College of Veterinary Medicine. In 1989, he joined Diamond Scientific in their technical services department, where he was promoted to the director of veterinary operations. In June of 1990, he moved to SmithKline Beecham Animal Health, now Zoetis, as a senior technical services veterinarian, with his main emphasis on dairy and its allied sectors. He currently holds the title of Director of Technical Services Cattle Immunology. His responsibilities are about 75% North American and 25% international. He has many publications on viral infections, immunology, neonatal immunology, and young dairy calf management, several textbook chapters, and guest lectures at many veterinary and university meetings, including the American Association of Bovine Practitioners, World Bariatrics Conference, and the ABMA. He received his diplomat status to American Board of Veterinary Practitioners, the dairy practice specialty, in 1995. In September 1997, at the American Association of Bovine Practitioners Conference in Montreal, he received the AABP's Award for Excellence. In 1999, he successfully completed his PhD in microbiology from the Western College of Veterinary Medicine, University of Saskatchewan. In 2013, Bovine Veterinarian Magazine selected Dr. Cortese as one of the 20 most influential cattle veterinarians in the United States. With that, I'd like to turn it over to Dr. Cortese.
Well, thank you, Dr. Jacob, and welcome everybody to this session. Today, we're going to spend a little bit of time talking about bovine respiratory disease. And as we take a look at pneumonia in cattle, no big surprise, it is the #1 economic loss in beef cattle, the #2 economic loss in dairy calves, and through the years, even with a lot of the new vaccines that have come on the market, the new antibiotics, we have seen actually a slow increase in respiratory disease in the beef cattle population. I think closer to home, there's nothing more frustrating than this time of year have a really nice group of calves I'm getting ready to wean. I wean those calves and I have to start pulling calves to treat for pneumonia. I think it's important to understand how severe pneumonia can impact the long-term performance of the animals in your herd. Research has shown that particularly pneumonias that occur under 4 months of age, those summer pneumonias that we often miss, can have long-term impacts on the animals hitting their genetic potential. We can see impacts on weight gain, feed efficiency, reproduction, and longevity in the herd being impacted by early respiratory disease. You may have already seen some of the impacts on weight gain and feed efficiency, but did you know that heifers that have early pneumonia are 2.5 times more likely to have calving problems? How many times we blame the bulls for not having calving ease, and we've forgotten that group of heifers had pneumonia 2 years earlier. In our studies, the first call that we do on our replacement heifers is not based off of genetics, it's based off of early pneumonia. If a heifer has early pneumonia, that's an animal we don't want to keep in our retention group because their survivability is dramatically decreased, their reproduction is decreased, and as you just heard, they have a lot more calving problems. If we take a look at all the different things that are involved with respiratory disease in cattle, there's a reason why it's called the respiratory disease complex. And that's because it is complex. There is a lot of different things that are involved in a respiratory disease outbreak rather than just a virus or bacteria that the veterinarian picks up when he's doing sampling of those animals and treating them for disease. Underlying stresses, nutritional deficiencies, parasites, poor vaccination handling or programs can all play a role in here, and also in higher risk groups of animals, whether we use a metaphylactic antibiotic to decrease the likelihood of an outbreak can also be involved here. And so you can see that while each of these is their own independent segment, we're going to focus today on what is changing with the vaccination programs as we've seen dramatic shifts over the last 10 years in vaccination programs in both beef and dairy calves being driven by some of the new research as well as trying to understand how to better improve our protection against respiratory disease in these cattle. So let's talk about those changes. In the last 10 years, as we've seen new research come out, we've seen a dramatic shift in vaccination protocols, both in beef and dairy calves. And I'm sure that many of you have been involved in making these changes on your facilities. The big changes have been the incorporation of intranasal vaccinations for viral vaccines as a cornerstone to the viral vaccination program in beef and dairy calves. Many of you have probably been using Enforce 3 for several years and have had that put into your vaccination program to help to not only improve my viral protection against the 3 viruses that are in that intranasal vaccine, but also to make my other vaccines work better. So let's spend a little bit of time talking about why we've seen this change towards intranasal vaccinations. Because as we look at Enforce 3 over the last 10 years, it has now become the #1 used vaccine in beef calves in North America and is gaining popularity worldwide and rapidly becoming the #1 vaccine worldwide used in beef cattle and dairy calves as well. There are several important concepts that are fairly new that have helped to deliver the changes that we see in these vaccination programs. The first one is what is called vaccine interference. Now, normally when we vaccinate beef calves, we're going to take and give several vaccines at the same time because we don't want to have to try to catch those calves multiple times. Several years ago, a study was published in Canada where they looked at giving injectable viral vaccines along with Pasteurella vaccines. And they showed that the injectable viral vaccines blocked the Pasteurella response. Several years later, I was involved in studies that got published with North Dakota State University, where we were able to replicate that with many of the current vaccines on the market when these calves were vaccinated for the first time. And it did not change by age. It was solely driven by the first time those calves were vaccinated. So whether it was at branding turnout time, pre-wean, or wean, if it was the first time those calves are being vaccinated, if they're given an injectable viral vaccine and a Pasteurella vaccine, only 1 out of 3 had a protective response. In a paper I just published earlier this year, I showed also that injectable viral vaccines have a blockage of clostridial vaccines. Now, I know that many of you, when you do your branding turnout shots, your pre-wean shots, are giving a clostridial vaccination along with your viral vaccinations. So what has that got to do with intranasal vaccinations? Well, the follow-up study that was done by North Dakota State showed that if the viral vaccines went intranasally, then my bacterial vaccines had normal responses. And so we began to see, when these studies came out several years ago, a rapid shift of our vaccination protocols the first time these calves are being handled, of going with an intranasal with my bacterial vaccinations rather than injectable. And we've certainly seen across the country the Enforce 3 become the vaccine of choice as my primary viral at branding turnout or at pre-wean. Right behind this set of studies was a whole other set of studies that began to look at what is called Prime Boost. And Prime Boost actually started on the human side, where they're trying to find ways to better stimulate the immune system in children against diseases like polio. And then they began to look at using it for diseases like HIV, Ebola, some of these diseases that we don't have vaccines for. Prime Boost involves using different vaccine technologies to improve your overall protection. Studies have then been published at several different universities that have shown that when I incorporate an intranasal followed by an injectable, that it improves my protection dramatically over going with just the intranasal every time or just the injectable. And so we've seen these two basic concepts begin to dramatically change our vaccination programs in cattle. So why Enforce 3? What made Enforce 3 this cornerstone? Well, if we take a look at the research that's been done with Enforce 3, it dramatically improves the level of protection at the route of entry for many of these diseases. Enforce 3 includes our primary viruses of IBR, influenza, parainfluenza, as well as bovine respiratory syncytial virus, one of the most common viruses we see circulating through cattle, particularly out on pasture. In a study that we did last year in Montana, where we just randomly went into herds with no summer pneumonia, doing nasal swabs, we found that about 40% of those herds had BRSV circulating on that one day when we happened to sample calves. And so we see that BRSV circulates all the time. It helps to make the other vaccines work better, as we just talked about, and also works better in that prime boost for our future vaccinations. This is some of the basic reasons why Enforce 3 has become a major cornerstone of vaccination protocols. So what have we learned on the most recent studies? There are two recent studies that were done looking at what do these vaccination programs look like in beef calves, and these were published at the end of last year and early this year. One of the first things that we discovered was that if we can incorporate an intranasal vaccine on the day of birth, it will dramatically impact my levels of summer pneumonia, as well as improve all my vaccine responses, both injectable and intranasal, for the next 9 to 10 months. And so if you have the ability on your facility to handle those calves at birth, you're doing tagging, or maybe you're doing other management things with those calves, incorporating an Enforce 3 can have dramatic impacts on what you see in the herd. As a matter of fact, in the study, we compared giving Enforce 3 at birth and at branding turnout to just branding turnout. And we found differences in protection, and also all the calves that died in that study were calves that were vaccinated only at branding turnout time, not at birth. We also were able to take a look in this series of studies at what does the optimum program begin to look like in these beef calves. And it is a combination of intranasal and injectable vaccines. The program varies depending on the age of the calf when I start the program. If I start at birth and I'm going to come back at branding turnout time, a second intranasal is usually required there, along with a BVD vaccination and whatever else you may be wanting to administer. If I start at branding turnout time, then usually I just need one intranasal and then I can switch to my injectable. Or if I so desire, I can go with 2 intranasals and then switch to my injectable. If the first time I'm handling those calves is it pre-wean, it should be with an intranasal, then I can follow with my injectable. And if the first time I'm going to vaccinate those calves at weaning time, it should be the intranasal along with my BVD. I hope you're hearing the theme here. The first time these calves are vaccinated, to really prime that local immune system against respiratory disease, we need to use the Enforce 3 to really maximize out that local immunity and then build on that with our subsequent injectable vaccines. The first time or two can be the intranasals, and then we can switch to the injectables to utilize that whole prime boost concept to maximize out vaccination protocols and to increase our levels of protection. If we take a look at this dramatic change in vaccination programs we've seen in beef calves in the last few years, it's no surprise that we've seen Enforce 3 become a cornerstone of these vaccination programs based on all this new research that's coming out. As we look towards the future of vaccinating cattle, we're going to continue to see more work being done with this local immune system, oral and intranasal vaccinations. Work is being done right now looking at intranasal vaccination in adult cows and decreasing post-calving diseases like metritis and helping the cows to breed back quicker. And so we're seeing intranasal being used in many different ways in research today that's going to give us more insight into the future of how using different routes of administration for these vaccines can work to improve overall health and profitability of our herds. Joe and Jacob, I'll turn it over to you for any questions that we might have.
Dr. Cortese, I guess a question that I have is, can you speak to the interferon response that calves have to Enforce 3 and how that works?
Certainly. So one of the things that we've learned about intranasal viral vaccines through the years is that when you go with an intranasal vaccination, you're actually doing two things. Number one, you're vaccinating the animal, but number two, you're also upregulating or turning on the whole immune system. This is done through a series of chemical messengers that are released by the immune system, primarily driven by interferon. Research that I've been involved with shows that interferon helps to improve your overall health of the animal for about 14 to 21 days. Research out of Japan has shown that there's not only antiviral upregulation that occurs, but also antibacterial. And so we get a second benefit of using the intranasal vaccines beyond just the vaccination component. That's why we see so many arrival programs today involving the use of the intranasal along with other components to get the immune stimulation along with the vaccination.
Thank you. I just have one more follow-up question. Is there such a thing as too much interferon production?
So that's a great follow-up question. If you take a look in the literature, there certainly has been shown that if my interferon levels get too high, particularly systemically, both in humans and in cattle, that it becomes toxic. And in cattle, the very first thing that we begin to see is elevated temperatures and some pretty severe decreases in intakes. And actually, as cattle don't eat, then we can see increased respiratory disease. Now, if you think about that, the worst thing that I can do at weaning time is tell calves they don't want to eat because I'm trying to get them off of mom and broke to the bunk. And if I have too high an interferon level, when I wean those calves, they're going to wean a lot harder, they're going to bawl a lot longer, and I may have to pull calves for respiratory disease. And so getting the right level of interferon is important. There's still a lot of research being done trying to understand what those right levels are. And they probably vary by age of the animal and maturity of the immune system. Our best measurement today is by understanding what happens after we use different vaccines or vaccine combinations and seeing whether or not it's adversely impacting intakes, et cetera.
Thank you. Turn it over to Joe.
Sure. Yeah, it looks like we have some questions coming in from some online viewers. Thank you, Dr. Cortese and Dr. Jacob. Dr. Cortese, question from the viewers. Is Histophilus becoming a larger issue in feedlots? And if so, what are the best preventative measures for that?
So that's a great question. And there's a lot of discussion right now about Histophilus. We aren't sure at this point in time whether Histophilus is becoming more important in feedlots or if our diagnostics are just getting better or able to diagnose it better. Certainly, I think that we are seeing the diagnosis of Histophilus increasing. When you look at Histophilus, we've got to really talk about three different syndromes. Certainly, Histophilus pneumonia, which all the research has shown is secondary to another pathogen BRSV is a great example. Mycoplasma, maybe even coronavirus might be a trigger for Haemophilus. Haemophilus Brainer syndromes, which is more common in our colder weather states, particularly in the wintertime, and then the heart form, which is the small microabscesses. Of those three syndromes, Haemophilus vaccines have been shown to only protect against the Brainer syndrome that we see during the cold weather. Studies were done in Canada show that none of the Haemophilus vaccines protect against the heart lesion form, and there really has not been any good studies to assess how well Haemophilus vaccines work against that secondary pneumonia. While we often will incorporate Haemophilus vaccines in our vaccination program, in my experience, if I can get better control of my primaries and maybe use metaphylaxis or feed-grade antibiotics, I tend to get better control of Haemophilus than trying to rely on only my Haemophilus vaccines.
Sure. Okay. Great answer there. We have another viewer wondering, you mentioned kind of in relation to Enforce 3, helping prevent mastitis and metritis. Being Enforce 3 is a respiratory vaccine, the question kind of is, how can a respiratory vaccine help prevent some of those kinds of things?
So that really gets back to Dr. Jacobs' question about the ability of intranasal viral vaccines to turn on the immune system. Some of the new research that's been published recently has shown that when I turn on the respiratory immune system, I also turn on the reproductive immune system, that the two are bound together and have common pathing of the immune system. So when I turn on the antibacterial and antiviral immune modulation with an intranasal, I also turn on the intramammary and the reproductive. In a study that was just recently published, in dairy cows, we showed a dramatic and significant decrease in retained placentas, metritis, and mastitis, as well as cull rates and death in animals that were given an intranasal on the day of calving. We're actually beginning to see this starting to get incorporated in some of our more progressive beef herds that have high genetics, where they're starting to use an intranasal vaccination on day of calving for some of these same outcomes in beef calves. And it's been very interesting that there are about a half a dozen beef veterinary clinics across the country now that, if they have a dystocia, are giving an Enforce 3 after they pull the calf to help with that uterus cleaning up and decreasing the number of retained placentas. So we're starting to see this thing being looked at for the immune modulatory component in adult cattle, like it's been used in calves for many years.
Very good answer there as well. We have a viewer wondering if this is going to be recorded. I'd like to remind you guys that this video will be recorded. It'll be available on our Facebook page as well as our YouTube channel to go back and view later in case you've missed any portions of it. Got a question here about giving once PMH IN at the same time as Enforce 3. Would you like to kind of comment on that? And then maybe in addition to that, talk about maybe some of the other vaccines that maybe you would recommend using with Enforce 3. Obviously, it doesn't have a BVD component into it. So kind of what would you recommend alongside Enforce 3 for guys in their vaccine protocols?
Great question. So there has not been any research published yet that shows how Enforce 3 and other intranasal vaccines work. Whether I'm talking about Bovine, which is the coronavirus vaccine, once PMH intranasal, we really don't know how they work together. While they are often given at the same time, and I've not seen any major safety issues giving them, it's been very difficult to assess whether they're working or not. I try not to give the multiple intranasals at the same time, so I don't run into the same issue I run into if I'm giving multiple systemic vaccines at the same time in interference. Now, vaccines are commonly used in conjunction with Enforce 3. Certainly Clostridial vaccines are used almost every time that Enforce 3 is used in a branding turnout vaccination protocol. We see injectable BVD or BVD Pasteurella combinations like one-shot BVD is commonly used. We see a lot of places have tried to use Enforce 3 along with a 5-way viral vaccination, particularly on babies. That is a lot of virus at one time for that calf to try to handle. and we begin to push that interferon level that Dr. Jacob was asking about, and may actually knock those calves off feed. As a matter of fact, a study done at North Dakota State by Dr. Stucka showed that even in older 7-weight steers, when I gave an intranasal with a 5-way viral at the same time, an intranasal viral, that it decreased intakes and weight gains for over 10 days. And so we really try not to give an intranasal plus a 5-way viral at the same time because of that high viral load that those cattle have got to handle.
Yeah, that makes a lot of sense. You did a pretty good job of covering kind of the term prime boost earlier in the presentation. There's a question from a viewer wondering, does prime boost only happen in young calves? Is there an age where that resets? Maybe you want to touch on, is it only, prime boost only happen in young calves?
So that's a big area that we don't understand at this point in time. Most of the research has been done both in humans and in cattle and in pigs for that matter, have been in the fairly young animal. However, in some of the more recent studies that I've done, where I've looked at prime boost, I've been able to show prime boost in yearling replacement heifers, where I've used different types of injectable vaccines to be able to prime boost it. In the dairy cow studies I've been doing, I've been able to show re-prime boosting in mature cows with the intranasal and the injectable. So it looks like it probably resets on about a yearly basis, approximately. So we can relook at repriming the immune system every year to 2 years if we want to keep trying to maximize that level of protection. But it's an area that we don't understand very well at this point. Remember that prime boost studies are still fairly new and a pretty new concept in veterinary medicine, whereas it's been a common concept on human immunology for over 15 years.
Sure, absolutely. Lots to figure out there yet too. Could you comment on one term that we hear a lot when we talk about vaccine protocols is the amount of gram negatives that we're giving at one time? Could you kind of touch on that a little bit and some factors to consider? And does Enforce 3 need to be considered as a gram negative?
So this whole area of gram negative reactions and gram negative numbers is extremely important as we look at adverse reactions in cattle, whether we're talking about calves or we're talking about adults. Basically you have your virals, which is your IBR, BVD, parainfluenza, and BRSV, rotavirus, coronavirus, and then basically everything else is going to be a bacterial vaccine. So whether I'm talking about scours, E. coli vaccines, clostridial vaccines, pneumonia vaccines for Mannheimia, those are all bacterial vaccines. The vast majority of those are gram-negative vaccines. The problem that we run into is that as we give multiple vaccines, the components of those gram-negatives that cause reactions stack or add together. And so the more gram-negatives we get, the more likely we are to see adverse reactions. Now, these adverse reactions may be fairly minor, decreased intakes, decreased milk production, increased temperatures, or they can become very severe, abortions, and actually delayed death loss, where we'll see calves or yearlings or cows that have been vaccinated, they're fine that night, and we find them down or dead the next morning from a delayed reaction. The rule of thumb that we tend to use is that in my crossbred beef cattle, I don't give any more than 3 gram-negative vaccines on any one day. And on my purebred beef cattle and on my dairy cattle, I give no more than 2 gram-negatives on any one day, or my risk of adverse reactions go up dramatically. There is also a component of increased adverse reactions to these gram-negatives if I have deficiencies in vitamin E, selenium, or copper. So there is a nutritional component and a genetic component that's all involved with these adverse reactions to gram-negatives.
Very good. Another question that's come in here is in regard to mycoplasma. Are we seeing mycoplasma as kind of a growing issue in the beef industry? And is it possible to safely kind of manage potential carriers in a breeding herd, or how would you kind of answer that?
So definitely mycoplasma has emerged as we've learned more about that bacteria. as a major player in respiratory disease. We know that it can be transmitted very early through colostrum and through milk in an infected cow and can circulate through a herd. Mycoplasma can be one of our most difficult pathogens to work with because we don't have any really effective vaccines that have been licensed yet. Certainly an area of huge research trying to get really effective mycoplasma vaccines. A lot of what we do with metaphylactic antibiotics has been aimed at controlling mycoplasma in populations. Now, can we control it on a herd basis? I think that if a cow-calf herd has got a lot of mycoplasma issues, one of the very first things I've got to do is begin to assess whether or not I have mycoplasma in my cows. We certainly know from what we learned on the dairy side of mycoplasma that the cows can be carriers and transmit it, and that we can actually call out mycoplasma carriers and clean up a herd for mycoplasma, particularly in my younger calves. In arrival cattle, it's almost impossible because I'm getting cattle from so many different facilities, right, which is why we use metaphylaxis. But it's certainly in a cow-calf herd, if I'm seeing a lot of mycoplasmonia, I think it warrants further investigation as to what is the source of that mycoplasma, and then can I control it and clear it from the herd.
Very good. It looks like that's all the questions we have from our viewers. Once again, I'd like to remind you, if you think of some other questions, if you're watching the recorded version of this, please feel free to still leave those in the comment section. We'll certainly go back and answer them for you if you have something else that comes up. So we'd again like to thank Dr. Cortese and Dr. Jacob for taking time to be a part of today's Facebook Live event. We hope that everybody out there was able to learn something useful that they'll be able to take back and apply to their own operation. And feel free to share this with your friends. Feel free to share this Facebook Live video series so everyone else can get in on the fun too. Once again, want to remind you, this has been recorded. Feel free to go back to our Facebook page on Armor Animal Health or our website as well, or our YouTube channel to go back and watch the recorded version. And also there'll be a survey posted in the comment section. If you want to help us better provide suggestions for future videos, feel free to do that survey portion as well. We also want to remind you that we have our virtual Dairy Expo coming up September 29th through October 3rd. Throughout the week, we want you to watch pay attention to our Facebook page for various contests, giveaways, and introductions to team members, as well as much more. So please, for that, go on our website or click going on the Facebook page as well. Next week on Have You Heard, we'll have Steve Stafford with Vigortone Nutrition, as well as Guy Halverson, and they'll be discussing the nutritional needs for your cattle coming up for the winter months here. And with that, we'll see you next Thursday on Have You Heard. Thanks for joining us.